Good afternoon and welcome to the daily briefing here in St. Clair County. Sam Bierman is with us today from the Health Department. Sam, more numbers.
More numbers, and today, as we have said, we're looking forward to the day where we have no new numbers, and again, today is unfortunately not that day. So the numbers that we are going to give you for St. Clair County are those for St. Clair County residents that have been tested, and as of today, we are at 2,345 that have been tested. 570 positive test results, which is an increase of 20 from yesterday, and that includes both males and females from their 20s up to their 90s. We're at 1,739 negative test results, with 35 test results still pending. And today we do have some sad news to report. We are announcing 2 new deaths, so we are now at 49 as for a total. The first was a female in her 80s who did have underlying health conditions, and the second was a male in his 80s who also had underlying health conditions. And our thoughts and prayers go out to those families. For state totals, we are at 333,147 that have been tested, 63,840 positive test results, which is an increase of 2,341 from yesterday. And we are reporting 2,662 deaths today, which is an increase of 44 for the state. Hospitalization numbers for hospitals that are in St. Clair County. Currently, we have 59 patients admitted for COVID-related reasons, and 5 of those patients are currently on ventilators. For our congregate living facilities that are currently in outbreak status, and those of you who have been watching the daily briefings will notice that in days past, we had reported long-term care facilities, and we have since changed that to congregate living facilities because we have added 2 new facilities that are not long-term care, but are considered congregate living facilities. And those include residents or staff that have 2 or more COVID-positive patients or that have COVID-like symptoms. The first, Bria of Belleville, has 12 positive cases and 2 deaths. Bria of Cahokia has 5 cases and no deaths. Caritas Family Solutions in Belleville has 6 cases. Colonnade in O'Fallon has 3 cases and no deaths. Four Fountains in Belleville has 61 cases and 12 deaths. Help at Home in O'Fallon currently has 5 cases. Memorial Care Center in Belleville has 43 cases and 5 deaths. St. Paul's Home in Belleville has 5 cases and 1 death. And Lebanon Care Center in Lebanon has 33 cases and 4 deaths. And as a reminder, St. Clair County Health Department is still open for any of those citizens of St. Clair County that need to utilize our services, whether you are currently utilizing them or you have questions about potentially utilizing them in the future. We are still open. We are open by appointment only. So if you have any questions, please feel free to call. And that number is 618-233-7703. And one last thing before I turn it over to Chairman Kern is just would like to remind you that Southern Illinois Healthcare Foundation has 3 testing sites that are up and running. The first is 7210 West Main in Belleville. The second is 100 North 8th Street in East St. Louis, which is the Windsor building. And the third is 509 Camp Jackson in Cahokia. And if you are needing to go to one of those facilities, the number that you need to call for pre-screening is 646-2596, and they will walk through the steps with you. And as testing capacity expands, you will see that the testing is available for the following: people that have COVID-19-like symptoms, which could be cough, shortness of breath, fever, or difficulty breathing, or that would put them in a higher risk factor category, which would be that they had contact with someone who is a known COVID-19 positive case, or if they have a compromised immune system due to an underlying health condition. Testing is also available for those individuals who may or may not have symptoms that fall into one of the following categories. They work in a healthcare facility, they are a first responder, working in a correctional facility, jail, or a prison, or in a critical infrastructure position such as workers in grocery stores, pharmacies, restaurants, and gas stations. And if you have any questions about Southern Illinois Healthcare Testing Site Foundation testing sites. Again, please call 646-2596. And now I will turn it over to Chairman Kern for his update.
Thank you, Sam. The county is, wanting to reopen. Certainly, we want our businesses to reopen, but as we know from the medical community, that can't happen until people who are hospitalized for COVID-19, until those numbers start to go down. Unfortunately, we see today the number of people hospitalized is 10 above what it was on May 1st. So we're not going down, we are seeing now an uptick. Don't know what that's caused by. We hope that everybody is continuing to wear masks, socially distance, keep yourself, your hands washed, and do all the smart things that you've been recommended to do. That way we can get things going down and we can get to a point where we can reopen again. We are preparing for that in the county courthouse. Today I saw our Public Building Commission workers making splash barriers that will be put up all throughout the courthouse and the offices to protect you and protect the employees. So those are currently being constructed and put up in preparation for reopening, which we hope is going to be more sooner than later. Remember, maybe it's gone by the wayside, but just remember to call neighbors, friends, family that you haven't heard from for a while, just to make sure everybody's okay, and kind of break up the monotony of many people having to stay at home, especially those that have immune systems that are compromised or the elderly. Those are the ones it's important that they're staying, especially important that they're staying inside. Also, remember to keep that diary every day, people you come in contact with. So if you are diagnosed as COVID positive, we'll be able to see who you were in touch with. It'll make the tracing easier after we find out the diagnosis from the testing. Our zip code reports today in 62201, there are 13. 62203, there are 20. 62204, there are now 27, that's an increase of 1. 62205, there are 21, that is an increase of 1. 62206, there are 51. 62207, there are now 28, that's an increase of 2. 62208, there are 36. 62220, there are now 54, that is an increase of 1. 62221, there are 43. 62223, there are 35. 62226, there are 74. 62232, there are now 6 COVID positive people in that zip code. 62239, there are 8. 62254, there are 17. 62257, there are 7. 62258, there are 14. 62269, there are now 49, that is an increase of 1. And 62285 remains static at 6. If your zip code wasn't mentioned, doesn't mean that there's no one in that zip code without COVID, that there isn't anyone in your zip code with COVID-19. What it means is we haven't risen to the level of 6 yet. So, we're relying now, law enforcement is particularly important during this time. People are being asked to stay 6 feet apart, to observe social distancing, do all the things that are recommended in the governor's executive order. Today, going to talk about how things are going in the St. Clair County Sheriff's Department is Major Daniel Stockett. He is the chief deputy the chief deputy in the St. Clair County Sheriff's Department. So, tell us, how are things going in the department, Chief?
It has definitely changed the way we conduct business. A lot of precautions are set in place in order to keep the deputies safe and the citizens of St. Clair County. We're in compliance with wearing the mask, the gloves. Extra steps are taken for disinfecting and cleaning the patrol vehicles. We just really changed the way we kind of conduct business.
So keeping the virus out of the jail has to be job one for you and for your department.
Yes, sir.
And so far, so good. I guess we probably shouldn't say that, but you've been successful in administering your procedures.
Yes, sir.
What are those? So you're taking temperatures of inmates who are coming in?
Anybody that's coming in, we're taking temperatures before they even get into the booking area. So those temperatures being taken. It's a list of questions that's being asked, related to COVID-19, just to ensure that they're not positive. And if it is a situation that the temperature is high, we'll get them to a hospital, get them tested, and take some other steps to ensure that we keep everyone safe inside the jail.
And the sheriff's been real proactive early on. He added an intake nurse to make sure that we had that as soon as somebody entered in the jail. How's that working out?
It is working well. It is really working well. Having that extra person really helps out the medical staff, who's working hard to try to keep everybody safe. So that extra person has really helped out.
So I know in St. Clair County, a couple of the departments have had people that have come down, officers have come down with COVID-19. I don't think the sheriff's department has had that yet, but Cook County deputy died this morning. The corrections officer in Cook County also came down with the virus. This has to be of a that this is always on your mind for bringing this home to your family. How are you coping with that?
It is very stressful. We know that the work and the job that we perform has some hazards involved in it. We are definitely stressing to all the deputies and correction officers to take all precautions and be safe, for us leaving home. Some extra stuff, getting out of the clothes, maybe in the garage, just some extra things that you can do that'll help protect your family. So yeah, it is a little stressful, because the one thing that you really don't want to do is, we know we're exposed to danger every day, but you don't really want to put your family in danger of anything, any harm. So
a lot of times people, from what I'm hearing, people feel, well, it's my body. If I want to be careless and go out in the community and do all the things that are not recommended, that they think it just affects them. But it affects you. It
Yes.
affects the medical community and causes you to do a lot of additional things that you wouldn't have to do to protect yourself and your family.
correct. Yes.
And you can't always do that 100%. I mean, that danger is always out there. So how is the community? Are you seeing a large amount of non-compliance, or is the public generally compliant with the executive order?
The public is generally compliant, and there have been some instances where we have people that were not compliant, but once we made the contact with them and talked to them, explained the seriousness of it, we got compliance, and I really appreciate that. So.
And I think it's really making, or at least allowing people to understand why the executive order's out there. The governor didn't create the virus. That
Right.
order is out there because of the virus. The last thing our governor would want to do would be to shut down business or keep people from leaving their home. But
Yes.
this executive order is trying to shorten the length of this virus.
Yes, and we're just hoping that people will continue to abide by the executive order so we can put this behind us and move forward.
So, are there any recommendations or anything you want to talk about that you would advise people during this time?
We ask people to really just abide by the executive order, continue to be safe, and I did want to say this because there is a large number of people who's violating traffic offenses, and I'm saying it because it's safety issues involved in that. People, please, abide by the speed limit. Do all the things that you need to do to keep yourself safe and others. It's been people that's just kind of driving reckless, and then there's enforcement that has to be taken in order to keep the general public safe. So, and wear your mask, wear your gloves, be safe, try to do the social distance as much as possible, and just do all you can to try to keep yourself safe and others.
So why do you think, and I've heard of high speed that people are traveling on some of our roadways. Do you think it's because they think they're the only ones that are out?
I think it's that they feel there's maybe some lack of enforcement at this time because of everything that is going on. But if you're breaking the law and violating, they will be enforced because this is serious business. So I think some people just think that a lot of enforcement is not being done now. So they're kind of just being hazardous to some people.
But that's not true. Your officers are out there and
Yes,
are
sir.
doing their job.
Yes, sir. They're out there and will enforce if necessary. We're really just hoping everybody would comply and go with what needs to be done to get us past this. So,
Great. Herb Simmons?
Good. Thanks for coming in today. We appreciate it. One question. your deputies, when you're having roll calls, are any of them showing any stress levels? I mean, they're out there dealing with the public, they're out there handling these calls. Is there something you have set up there at the command post that if one of the deputies may have a little concern about this COVID-19 of taking it home, as the chairman said, have you had any of that, or do you have something in place to address that?
We do have something in place if a deputy feels that level of stress and needs to talk to someone. We definitely have that service available for them to talk. Constant, continuous information is being relayed to them during briefing for safety gear, and we're definitely stressing them to use the safety precautions that are set in place.
Well, Major, we appreciate you coming in today and providing that information, so be safe out there.
Yes, sir.
Thank
Will
you,
do.
Major. We
Thank you.
appreciate you being of service during this time especially.
Yes, sir. Thank you.
Thank you.
Just a couple things on the EMA side. For those of you who've been following us know we've had the National Guard here at the EOC. Today we got notified that their mission is being changed from more of monitoring the hospital status. They're going to be assigned to keeping track of the long-term care facilities there in the county. They're still here with us, but their mission has just been changed a little bit, so we'll still be working with them. The other thing, one of our followers asked if we would just mention that May is a Skin Cancer Awareness Month, and today is actually known as Melanoma Monday. So we told her we would put that out there. So we have quite a few people following us, and we appreciate that heads up. You heard the numbers from Sam again today. Statewide positive 2,341 across the state. 44 more deaths to report statewide. 2 more here in St. Clair County. That means 2 more of our county residents that aren't with us anymore. So we're going to continue to bring you these updates. Hopefully, when that day comes, we can all just thank God that we made it through, because there's a lot of people that's not going to be able to say that. So we'll be back tomorrow at 3:30 for the next update, and we'll have Daisy back here in just a few minutes to translate this to our Spanish communities. Thank you.